Singapore's largest medical school is launching the country's first doctorate in nursing practice. NUS Nursing will also expand its master's offering to 3 new areas. This comes amid efforts to offer more career pathways for nurses to prepare them for evolving roles as Singapore's population ages.
The requirements of nurses are still changing, and changing even more rapidly now, because we have an aging population, which is giving rise to a different patient mix. Patients get older, they increasingly require less episodic care, but more coordinated and consolidated care to better manage multiple and complex conditions. We need a skills future strategy for healthcare and for nursing, and we will need to partner IHLs to deliver this strategy.
The Doctorate of Nursing practice degree is designed to equip experienced nurses with skills like leadership and advanced clinical expertise. It will be a 2-year program and will start this month with 16 students. NUS Nursing's 3 new master's programs will focus on areas with growing demand, like critical care, infection control and community health. All the new programs are designed to be flexible so nurses can continue to work while studying. And for more on how the doctorate and master's programs will strengthen expertise and leadership, we have Associate Professor Zhou Wentao, Deputy Head of Postgraduate Programmes, Alice Lee Centre for Nursing Studies. Prof. Zhou, thanks for joining me this evening. What prompted this move to offer postgraduate programs for nurses?
Thanks for having me. As the healthcare system evolves, so must nursing education, because nurses today is no longer just the caregiver. They are leaders in caregiving, innovation, as well as healthcare system change. So able to support the expanded role, advanced nursing education in master level and doctoral level is no longer an option. It is a must. So that is why we have launched all our new program to really equip all the nurses with the experience, with the confidence in leading the healthcare complex multidisciplinary teams, because the care become more complex, as well as shape for policies and drive for healthcare transformation. All these are the reasons.
And what does this 2-year program offer?
It's about Doctorate of Nursing program. Yeah, it's about, we have this 2 years part-time program is mainly focused to deliver to the nurses already with a master program, master degree. They have in 3 years working experience and come back to enhance their leadership ability. So during the 3 years, we do offer a multiple variety courses from the leadership, evidence-based practice, implementation science, as well as the healthcare policies, healthcare finance, and cost analysis, is to really allow them to have the wide competencies to lead the healthcare.
Yeah. And tell me, how are the areas of the 3 master's programs decided? How do you decide the areas?
So any program being developed is based on the healthcare needs.
Right.
So when the time we do the needs analysis, we actually do realize there's no such kind of program. Our program is plug the gaps in our healthcare system as well as education. So that is the reason why we developed the programs.
Okay.
Yeah.
Now, this doctorate program aims to equip experienced nurses with advanced clinical expertise, with critical thinking, with leadership capabilities.
Yeah.
Why is it important for nurses to learn about these areas?
Okay. So critical thinking is a very fundamental ability for decision making. So all the nurses should equip with this ability. While for the nurses being trained at the advanced doctorate level, the whole intention is to allowing them to have the critical thinking ability even more broader, thinking at the system level, at strategic level. Because by attending the program, all the contents allowing them to have the broader view and far of future-ready kind of decision-making.
Right.
Yeah.
Now, nurses typically do not make decisions on management or delivery of patient care. So now that they are more equipped, what are some of the decisions they are be making, and how does it complement their work with the doctors?
Yeah. To allow me tweak a little bit, indeed, nurses, we are actually in the leadership position, make critical decisions, because that is to ensure the public health safety. And by saying this, we do have nurse leaders actually sitting in the Ministry of Health, our Chief Nursing Officer. Currently, we do have nurses actually sit in the Chief CEO position and Deputy CEO position, which all of them are making critical decisions and lead the team day and day. But of course, we do have a lot of other leaders to lead the team to make sure our healthcare system to run as per normal. So the system need to run and the patient need to be cared for. But however, we hope to have more such kind of nurses leading change, because the government is emphasizing to shift the care from the hospital to community. We really need to have more nurses with the leadership capability.
Sure.
Yeah.
Now, this program, how will it help nurses bridge the gap with practice and administration?
Hey, thanks. A very good question. So in this program, we do let our students do a real-life project. So they must identify a problem in the current working settings. From there, they need to develop an effective intervention and implement this intervention and evaluate this intervention. And hope by doing so, they can narrow the clinical gaps and to find a good solution to make changes. But of course, because the program is a part-time program, whatever they learned, the theory in school, straight away they can apply into the clinical setting or the healthcare systems. So that is allowing them to narrow the gap between clinical and administrative roles. Yeah.
Okay. Last question, Prof. Zhou. Now, this new program, your first intake is 16 students, right?
Yeah.
And given the urgency, as our minister has said, to develop the capabilities and expertise of the nurse, is there a target that you have over a period of time, say in the next 3 to 5 years?
Okay, we are looking for per cohort is about 20 students applications, and so for the next 3 years we are aiming for 60s. Yeah.
All right. Congrats on launching the program, Prof. And thanks for joining us this evening.
Thank you. Please allowing me to use this opportunity to say Happy Nurses Day to all my fellow colleagues, fellow nurses in Singapore.
Oh,
thank you.
Right.
It's Nurses Day.
All right.
Thank you.
Thank you. And happy nurses to you too, Prof.
Thank you.
Right.
Thank you.
And that was Associate Prof. Zhou Wentao from the NUS Alice Lee Center for Nursing Studies.